breast reduction operation is, I have to say, one of the most high satisfaction operations we do, because a lot of the patients have symptoms like back pain, neck ache. So the operation is a 2-hour operation, usually a one-night stay, occasionally day case. And mainly it involves reducing the volume in the breast, usually from the lower part and from the sides. It also involves performing a breast lift at the same time. And invariably, we make the little areola, the pigmentation around the nipple, smaller. So overall, the breast reduction ends up with a smaller, lifted breast that's more in proportion to a patient's frame. Good candidates for a breast reduction procedure are those who have stopped growing. So anyone really over the age of 18 whose breast tissue has stabilized and who finds that the breasts are too big for their frame. So this can affect their quality of life, their activities that they want to undertake, clothing. Sometimes if the breasts are very large, patients can experience a skin rash underneath the crease of the breast. And of course, many patients will have backache, shoulder indentations from the bras, and neck pain. So these are all good candidates, as long as, of course, they understand all the risks as well. I wouldn't say there's an age limit. There is a starting age. I really wouldn't be comfortable operating on somebody under the age of 18 unless there was a very good specific reason. But beyond that, no, I think as long as somebody is healthy and is able to withstand the procedure and the anesthetic, as long as they don't have any other health conditions. I have patients who have this procedure in their 70s. The main benefits of the operation are lighter, more comfortable breasts. And frequently, after a breast reduction operation, the first thing I notice when they come back to see me a few weeks later is they're standing better, their posture's improved. Often they'll be wearing clothes that they have always wanted to wear, but they couldn't. So you can always sense this increased sense of confidence. And then frequently people use this as a kickstart to then improve their exercise regime, and then subsequently their benefits in weight loss. The risks, any operation has risks. It's a safe operation, but things like making sure that the anesthetic is right, allowing the scars to heal, and changes in nipple sensation, ability to breastfeed. This is some of the risks that one needs to discuss and consider when planning a breast reduction. To be honest with you, I would say that the vast majority of my patients will take painkillers for 1, maybe 2 days. This is because primarily we're dealing with soft tissue. We're not really cutting into muscle. So there is some pain. Patients will take painkillers, but then they'll voluntarily stop, even though if we give them a whole week's supply, often they'll come back and say, I only took it for 1 or 2 days. Everyone has to wear a bra for 6 weeks. I need my patients to be walking around from day 1, but I ask them not to lift anything heavy, not to go to the gym, not to start running around, driving from about 7 to 10 days. The scars in most cases have healed fully by 6 weeks. People go back to work, depending on the type of job they do, between 7 and 14 days. And then the swelling that occurs with this type of surgery settles down over a period of 3 months. And that doesn't stop you from doing things. You just have to be aware that it'll take about that long before you can truly assess your final results. Immediately after surgery, I would like my patients to be walking around. That's really important because it improves blood supply, but no heavy lifting, and certainly not going to the gym. I'm happy for them to shower, but they mustn't bath or take a swim, and that would be for about 6 weeks.